Let's bring you news from the health sector in the southeast and the southwest now, and let's begin in the southeast, where the federal government has awarded a contract for the construction of a mental health clinic in each of the senatorial districts of the southeast. The medical director, Federal Neuropsychiatric Hospital Enugu, made this known during an inaugural zonal meeting of community mental health project officers for the southeast zone. He says over 9,000 psychiatric patients were recorded in the institution within the last 5 years, and about 2,000 patients are brought to the facility annually.
It's the inaugural zonal meeting of community mental health project officers in the 5 southeastern states of the country, as well as officials of ministries of health and stakeholders in the sector. The objective is to find ways of incorporating mental health care into the new primary health policy of the federal government, known as Primary Health Care Under One Roof. The medical director of Federal Neuropsychiatric Hospital Enugu, Dr. Jojo Onukwe, shares his findings that the use of illicit drugs is a major risk factor and advises families of those who show signs of mental sickness to seek urgent medical attention. To spread the knowledge required in dealing with mental health issues faster, the group applauds the intention of the federal government to construct mental health clinics in each of the senatorial districts in the southeastern geopolitical zone.
In each of these senatorial zones, that means 3 clinics per state. So there are going to be 15 primary health care clinics built all around the southeast zone.
Whatever drug we do to your body is what alcohol we do to your body. It will change the physiology, it will change your behavior. That's what drug we do too. So people at times say it's alcoholism, it's addicting.
The project, made up of 15 mental health clinics, is expected to be completed by the end of 2017.
Resident doctors at the University of Ilorin Teaching Hospital have called on the federal government to rescind its decision to implement the rule of no work, no pay as a result of its earlier strike, to press home the demands for the payments of their salaries and improvement of their working conditions. In a solemn demonstration carrying placards across the premises of the teaching hospital, the doctors, who are led by the president, Alexander Ige, noted that the federal government has refused to pay their salary for 2 months of September and October last year.
I've been shortchanged now for so many years, and we have been tagged by the masses as people that love to go on strike. Now we are doing these demonstrations to tell the masses out there that the first thing on our mind is not always strike. Each time we agitate for our rights. Now we are doing this to tell the masses and also to tell the federal government the things that we have been asking for. See, we have state doctors that work in the states that have not been paid salary for months. Some have been receiving half salary for 6 months. As we speak right now, the residency training in Nigeria is not being funded, and Nigeria is the only place where residency training program is not being funded. And if you do not fund the residency training program, there is no how you are going to sustain the quality healthcare delivery and specialization in the country.
Finally, over 10,000 households are currently benefiting from the first phase of the federal government's national 5,000 Naira cash transfer program in Kwara State, north-central Nigeria. 12 local government areas are participating in the first phase, while the remaining 4 will be considered for the next batch. Same has been enjoyed by residents of Abeokuta, the Ogun State capital, southwest Nigeria. The money for poor families is part of the government's social intervention program.
A promise made, a promise kept, seems to be the message of the Buhari administration as it begins disbursement of cash stipends to poor members of society. In Abeokuta, the Ogun State capital, citizens speak on the need to identify the targeted beneficiaries of the program.
I want to appeal to government to ensure that it is well implemented, that the right target gets the amount of money that's been earmarked, or else the money will go into the wrong hands.
In Kwara State, one of the first states selected to benefit from the scheme, the permanent secretary of the Ministry of Youth and Sports says over 10,000 people are already receiving money from the exercise.
10,800 households have been identified across 12 local governments. The remaining 4 will join them this year because as at the time the data was being compiled, it first of all started with 6 local governments, then another 6. So the remaining 4 have been concluded, but undergoing processing. So as soon as the processing is concluded, they will join. So we will now be able to cover all the 16 local governments.
Meanwhile, the head of unit, Cash Transfer, Kwara State Ministry of Women Affairs and Social Development, says it will help the federal government tackle poverty in the country.
The 5,000 naira we are giving to the poor and vulnerable is beyond just giving them 5,000 naira. The money is not just to enrich them, but to improve the quality of their life. So what we intend to do later is to form these people into cooperative groups. So in this cooperative group, at the end of the day, they may also have access to collecting loans from the bank. All we will be doing is just to monitor and ensure that they are doing the right thing.
With the disbursement underway, the scheme is hoped to reach as many beneficiaries as possible in all the states of the Federation.
And that's where we call it a day for this edition of News Across Nigeria, where north, south, east, and west, we tell you what's happening across the country. Thank you for watching. I'm Olumide Macaulay.